5 things to know about strokes. 1. Deadly risk of stroke. Every 40 seconds, someone in the U.S. has a stroke. Stroke is the 5th leading cause of death in the U.S. and a major cause of long-term disability for adults. Families need to know more about preventing and identifying stroke. More than 795,000 people in the U.S. have a stroke every year. About 610,000 of these are first or new strokes. Meanwhile, nearly 25% of strokes are in people who have had a previous stroke. About 87% are ischemic strokes in which blood flow to the brain is blocked, according to the CDC.
2. Know what a stroke is. A stroke is an injury to the brain that results from a disruption of blood, usually an ischemic stroke, caused by a blood clot that prevents blood from flowing to part of the brain. Another type of stroke happens when an artery in the brain ruptures, often under the stress of hypertension, called hemorrhagic stroke.
3. Recognize risk factors. The most common modifiable risk factor is high blood pressure, and it contributes to more preventable strokes than any other modifiable risk factor. Atrial fibrillation carries a higher risk than hypertension, but doesn't cause as many strokes as hypertension since it is much less common. People who have heart disease or who have had a heart attack or coronary heart disease, where there's a problem with blood supply to the heart. High blood cholesterol, smoking, unhealthy eating, sedentary lifestyle, excess alcohol intake, illegal drug use and obesity are also risk factors for ischemic stroke. The main non-modifiable risk factor is age. If you have a family history of stroke, you're more likely to have a stroke. That may be in part because of inherited risk factors that we see like hypertension or type 2 diabetes, but also abnormalities like blood clotting which may be inherited. Another major risk factor is race. Black adults and Pacific Islander adults have the highest rates of death due to stroke, according to the CDC.
4. Strokes can happen in younger adults. We're seeing strokes increase in younger people because of the increase in risk factors with obesity, hypertension, and diabetes. Atrial fibrillation is a very strong risk factor for stroke that can be minimized with the right blood thinners. Somebody in their 20s or 30s who has this sudden onset of symptoms should also get immediate medical attention because they could have a stroke.
5. Symptoms appear suddenly. Symptoms develop very rapidly. The thing with stroke is typically we're talking about sudden onset, not something that occurs over days. The effects of a stroke can linger for days, weeks, and years. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.